Assalamu alaikum students, I hope you all are doing fine. Today we will be discussing the vessels of thorax. Now the vessels which we will study includes the superior vena cava, aorta, pulmonary trunk, their branches and the axial system of veins. Now we know that in the thorax, just posterior to the sternoclavicular joint, brachiocephalic veins are formed by the union of the internal jugular and the subclavian veins. That is, the left brachiocephalic vein is formed by the union of the left subclavian and the left internal jugular vein, whereas the right brachiocephalic vein is formed by the union of the right internal jugular and the right subclavian vein. The brachiocephalic vein from the both sides, that is right and left, they unite to form the superior vena cava. The left brachiocephalic vein is twice as long as the right brachiocephalic vein because it has to travel from the left to the right side. While moving from the left to right side, it runs across over the branches emerging from the arch of the aorta. The superior vena cava, which is formed by the union of the right and left brachiocephalic vein, it returns blood from all the structures present superior to the diaphragm except the lungs and the heart. This superior vena cava begins at the right first costal cartilage and then it moves downwards and ends at the level of the third costal cartilage by entering into the cavity of the right atrium. Now we know that the superior vena cava is present to the right side of the superior mediastinum, and important relations of the superior vena cava are that it is present anterolateral to the trachea and posterolateral to the ascending aorta. The right phrenic nerve, here it is present between the superior vena cava and the mediastinal pleura. The lower half of the superior vena cava is present in the middle mediastinum. Now we will discuss the aorta. Aorta, which is a great arterial trunk conducting blood to all parts of the body. It has three parts: the ascending aorta, the arch of aorta, and the descending aorta. The arch of aorta is a curved continuation of the ascending aorta, which begins posterior to the right second sternocostal joint, and after arising, it arches posteriorly to the left and inferiorly, and passes over the root of the left lung, and then becomes a descending aorta at the level of the second left sternocostal joint. So we can say that both the beginning and the ending of the arch of aorta, they are present at the same level, that is the right and left second sternocostal joint, which corresponds to the level of the fourth thoracic vertebra. The important branches of the arch of the aorta are the brachiocephalic trunk, the left common carotid artery, and the left subclavian artery. The brachiocephalic trunk is the largest and the first branch of the arch of aorta. After arising from the arch, it moves towards the right side and it gives rise to the right common carotid and the right subclavian artery. The left common carotid artery is the second branch of the arch of the aorta, ascending anterior to the left subclavian artery, and it enters the root of the neck by passing posterior to the sternoclavicular joint. The left subclavian artery, which is the third branch of the arch of aorta arising from the posterior part of the arch, it does not give any branch in the mediastinum and lies posterior to the left common carotid artery and enters the root of neck by passing posterior to the sternoclavicular joint. The descending aorta is a continuation of the arch of the aorta, which begins at the level of the inferior border of the fourth thoracic vertebra, descends in the posterior mediastinum on the left of the 5th to 12th thoracic vertebrae. It approaches in the median plane and pushes to the esophagus slightly towards the right side, and then passes posterior to the root of the lung, pericardium, and the esophagus. The descending aorta throughout its course is covered by the thoracic aortic plexus, which is an autonomic nerve plexus. The descending aorta becomes the abdominal aorta at the level of the 12th thoracic vertebra, where it pierces the diaphragm at the aortic hiatus and enters into the abdominal cavity. The major branches of the descending aorta are, we have 2 to 5 unpaired esophageal arteries, then we have the paired 9 posterior intercostal arteries and the bronchial arteries. The bronchial arteries on the left side, they are the direct branches of the descending aorta, whereas on the right side the bronchial arteries arises from the posterior intercostal arteries. Then we have the mediastinal branches supplying the structures in the mediastinum, we have the pericardial branches and the superior phrenic arteries. The pulmonary trunk, which is another important vessel of the thorax, it basically conveys the deoxygenated blood from the right ventricle of the heart to the lungs. The pulmonary trunk leaves the upper part of the right ventricle and it runs upward, backward and to the left about 5 cm long, terminates in the concavity of the arch of the aorta by dividing into the right and left pulmonary arteries. Now this pulmonary trunk together with the ascending aorta is enclosed in a fibrous pericardium and a sheet of the serous pericardium. The right pulmonary artery, a branch of the pulmonary trunk, it runs to the right behind the ascending aorta and the superior vena cava to enter the root of the right lung. Whereas the left pulmonary artery runs to the left in front of the descending aorta to enter the root of the left lung. Now the connection between the bifurcation of this pulmonary trunk and the lower concave surface of the arch of the aorta is known as the ligamentum arteriosum, which is basically a fibrous band. The coarctation of aorta is basically a congenital narrowing of the aorta, which can be present either proximal, opposite or distal to the site of attachment of the ligamentum arteriosum. Now what is the reason? The reason is that it results from an unusual quantity of the ductus arteriosus muscle which is present in the wall of the aorta, and when this ductus arteriosus contracts, the ductal muscles also contracts and the aortic lumen becomes narrowed. Later on, when fibrosis takes place in advanced cases, the aortic wall is also involved and the permanent narrowing occurs. The arch of the aorta, we know that it lies behind the manubrium sterni, and a gross dilatation of the aorta, which is known as the aneurysm, it may represent itself as a pulsatile swelling in the region of the suprasternal notch. This swelling or aneurysm, it can compress various structures present within the mediastinum, resulting in the mediastinal syndrome, which can represent in the form of dyspnea, dysphagia or dysphonia. Now we have discussed earlier that the connection between the arch of the aorta and the bifurcation of the pulmonary trunk is represented by the ligamentum arteriosum. This ligamentum arteriosum basically represents the prenatal structure, which is the ductus arteriosus. The ductus arteriosus basically represents the distal portion of the 6th left aortic arch and connects the left pulmonary artery to the beginning of the descending aorta. What happens that during fetal life, the blood passes through it from the pulmonary artery to the aorta, thus bypassing the lungs. But after birth, it normally constricts, later closes and becomes the ligamentum arteriosum. But if this ductus arteriosus fails to close, it may occur as an isolated congenital abnormality. A persistent patent ductus arteriosus results in high pressure aortic blood passing into the pulmonary artery, which will raise the pressure in the pulmonary circulation. A patent ductus arteriosus is a life-threatening condition and should be ligated and divided surgically. Now we will discuss the azygous system of veins. Azygous means unpaired. These unpaired veins are present on each side of the vertebral column, drains the back and the thoraco-abdominal wall as well as the mediastinal viscera. And this azygous system basically includes the azygous vein, the accessory hemiazygous vein and the hemiazygous vein. The azygous vein is basically formed by the union of the right ascending lumbar vein coming from the right common iliac vein and the right subcostal vein. It forms a collateral pathway between the superior vena cava and the inferior vena cava. It ascends in the posterior mediastinum close to the right side of the bodies of the inferior 8 thoracic vertebra, arching over the superior aspect of the root of the right lung, and then it enters or joins the superior vena cava. The tributaries of the azygous vein includes the 8 lower right intercostal veins, the right superior intercostal vein, the accessory hemiazygous vein or the superior hemiazygous vein, and the hemizygous vein or the inferior hemizygous vein, and it also has various mediastinal veins. The posterior intercostal vein, which are the main tributary of the azygous vein, it has a variable route of drainage. The first posterior intercostal vein drains into the brachiocephalic vein. The second, third and fourth on the right side, they form the right superior intercostal vein, which will drain into the azygous vein. The 5th to 11th will drain into the azygous vein. The second, third and fourth on the left side, they will drain into the left brachiocephalic vein. The 5th to 8th will drain into the accessory hemizygous, and 9th to 11th posterior intercostal veins will drain into the hemiazygous veins. Now we can see that the first intercostal vein, it drains on both sides on the brachiocephalic vein, and the second, third and fourth intercostal vein on the right side, they form the right superior intercostal vein draining into the azygous vein, whereas the second, third and fourth on the left side, they drain into the brachiocephalic vein. The 5 to 11 intercostal veins on the right side, they drain into the azygous vein, whereas on the left side, the 5 to 8 intercostal veins, they will drain into the accessory hemizygous vein, whereas the 9th, 10th and 11th intercostal veins, they will drain into the hemiazygous vein. The hemiazygous vein, also known as the inferior hemiazygous vein, it arises on the left side by the junction of the left subcostal and the ascending lumbar vein. Now this hemizygous vein, it then ascends on the left side of the vertebral column posterior to the thoracic aorta as far as the 9th thoracic vertebra. Here it crosses to the right side posterior to the aorta, thoracic duct and esophagus, and join the azygous vein. The hemizygous vein receives the inferior 3 posterior intercostal veins, the inferior esophageal veins, and the several small mediastinal veins. The accessory hemizygous vein, also known as the superior hemizygous vein, begins at the medial end of the 4th or 5th intercostal space and descends on the left side of the vertebral column from 5th to 8th thoracic vertebra. At the level of the 8th thoracic vertebra, it turns to the right, passes behind the aorta and the thoracic duct, and joins the azygous vein. It receives 5th to 8th left posterior intercostal veins. Sometimes the accessory hemiazygous vein, it joins the hemiazygous vein and opens with it into the azygous vein. I hope you have understood the great vessels of the thorax. Thank you.